You know, this stat is disturbing. 20% of soldiers returning home from Iraq and Afghanistan suffer from post-traumatic stress disorder. And some veterans say the only way they can cope is with medical marijuana. But the Department of Veteran Affairs will not pay for this. Is that fair? Let's debate it. We're joined by Iraq War veteran Paul Culikin. He's the founder of the New Mexico Medical Marijuana and Patients Group and a user of medical marijuana. It's helped him. And Dr. Andrea Barthwell is the founder and CEO of EM Global, a healthcare and drug policy consulting firm.
Barthwell is a doctor and a former deputy director of demand reduction for the Office of National Drug Control Policy. Andrea Barthwell is now a spokesperson for GW Pharmaceuticals. And why is this interesting? Because the company hired Barthwell to help get a drug derived from marijuana approved in the U.S. The drug, Sativex, is made from whole plant extracts, unlike Marinol, a synthetic THC drug that many medical marijuana users find ineffective. Chemically, Sativex is no different from marijuana, the plant. It is essentially marijuana in liquid form.
Well, thanks so much, guys, for joining us. First off, when, doctor, did you realize that medical marijuana might not be the answer, do you think? Or how much longer are they going to have to go before you find out if it's going to help these soldiers?
I don't think we're going to find that out, actually. I'm really sorry that Paul is experiencing the syndrome that he is. And my husband's a psychiatrist at the Veterans Administration, and he reports not only do we have issues with Iraq and Afghanistan, but Vietnam-era vets have reemergence of their symptoms when they see images of the war on TV. Finally, I've just returned to Chicago from burying my nephew who died of PTSD complications following a war duty stint. And I know very well that this is a serious disorder that, if left untreated, can lead to the complication of death.
Paul, we don't have
FDA.
Right, Paul. You're nodding your head. You know this. You're living with this. You've tried all different types of drugs. You say medical marijuana has helped you with post-traumatic stress syndrome, right?
Oh, Brian, absolutely. I mean, I've run the gamut of all the different medications at the VA, and basically I was at my limit. I was at the limit with my wife and my daughter, and my family was falling apart. And basically, it took my daughter looking at me and saying, "Dad, I don't want you to be grumpy anymore," and that basically did it. And I turned to medical cannabis, and basically, it's helped us ever since. I mean, my family life's improved. My relationship with my wife has improved. It's just been a blessing. It really has.
Doctor, you hear this personal story. If it works, why can't you support it?
We need to uphold the standard of medical care, and we need our veterans and our Pentagon to make sure that people in duty and people who have served us get the best that medical care can offer.
The VA in West Los Angeles, a top facility for veterans. But hospital officials now confirm a rash of overdoses from both prescription and illegal drugs.
I can tell you that there's been 5 deaths.
That's 5 deaths in less than 3 months in dorm-like residential halls.
And physicians have to have a body of preclinical and clinical data which allows them to make a good decision about what to prescribe from someone, and it just doesn't exist for marijuana. Having someone say that they have a good experience doesn't tell us how to treat. And if we were treating other conditions in a veterans population with untested substances, there'd be a huge
But here's the
outcry.
example, right, Dr. Barthwell, but Paul's...
However, one of the obstacles the FDA cites in restricting the medical usage of marijuana is the lack of scientific research studies on its risks and benefits. But despite the existence of many scientists who have applied for permits to grow, distribute, and administer marijuana for medical research, the legal hurdles to actually acquiring such permits have been substantial.
The problem was we got no answer, and so you in hiatus, so you have no idea what's happening. My name is Lyle Craker. I'm a professor at the University of Massachusetts in the Department of Plant, Soil, and Insect Sciences.
Professor Craker has been trying for years to get the government to give him authorization to grow marijuana so that he can distribute it to doctors for research purposes. He's now involved in a lawsuit with the DEA over their decision to deny him permission and trying to get it reversed. Why do you think they're taking so long?
I think they're taking a long time in deciding whether to issue this permit. although they have recently turned us down, and the reason we're going to court now to try and have the decision reversed. I think the reason they take so long is because this is a political type of decision. Their job is to keep this off the street, and this is one way of doing it, is to prevent anyone from growing it.
Marijuana has been approved for medical use in 13 states. However, federal officials continue to arrest and prosecute people, including doctors, for its distribution and use in those states. Some argue that people should go through the traditional route and get it approved through the FDA. However, the FDA continues to cite lack of evidence and research as reasons to deny access.
You know, Dr. Barthwell, we need to allow research to happen with medical marijuana or medical cannabis. The data is not there because the data actually is there. I mean, University of California has recently released data that says that medical marijuana actually does work. So the problem is that medical cannabis has been scheduled.
For many decades, marijuana has been the American poster child for how not to deal with a troubling psychoactive substance. By U.S. law, a Schedule I substance is one with no recognized medical use and great potential harm to the user. Marijuana has been classified as a Schedule I substance for many decades, along with heroin and LSD. Judging from its easy availability, low cost, and widespread current use, such a restrictive classification has failed to retard its use. In fact, enforcement of unrealistic laws regarding marijuana has probably caused more harm than marijuana itself. Although far from harmless by toxicologic or pathologic criteria, marijuana is much less dangerous than many other substances in less restrictive schedules like morphine and cocaine, not to mention the unscheduled legal mass killers, tobacco and alcohol. Of course, marijuana does have proven medical usefulness for some conditions. People obey laws they believe to be just. They do not obey the marijuana laws because they know they are unjust, even absurd. Kids quickly see through lies. Many kids may discount the proper scare tactics about really dangerous drugs like heroin and PCP because the dangers of marijuana have been so overstated. 90% of Americans believe that the federal government should not prosecute medical users of marijuana, despite the newest federal foolishness of the recent Supreme Court decision against it. This common-sense position of the people should give pause to any overzealous prosecutors who might have real trouble finding a jury that would convict a seriously ill user of medical marijuana. The court decision now provides the Congress and the Drug Enforcement Administration with a sterling opportunity to join with the population they are supposed to be serving and with the good science of the 10 states that have authorized the controlled use of medical marijuana and reclassify it as some level other than
the DEA hasn't allowed anyone to actually go through and study medical cannabis. So it's really hard to put the data there. I can't give the data if they don't allow us to study it. So.
Doctor?
That's actually not true. There have been lots of studies that have been done on the
Several prominent medical organizations, societies, and publications have endorsed the use of marijuana for medical or therapeutic purposes, including the American Academy of Family Physicians, the American Public Health Association, the American Nurses Associations, the New York State Association of County Health Officials, the California Medical Association, the Rhode Island Medical Society, American Medical Student Association, American Public Health Association, American Society of Addiction Medicine, Australian Medical Association, the New England Journal of Medicine, National Association for Public Health Policy, and many more.
The problem with medical marijuana is that there is not a standardized product to study. Physicians need a robust body of preclinical and clinical data to inform our prescribing decisions, and there are 2 FDA-approved medications for this condition, which reduces the symptoms and the frequency so that
it just doesn't seem to work for Paul, though. I mean, whatever the study is, this works for Paul. Don't you think he should be allowed to use it?
Absolutely.
We expect the Veterans Administration to support a standard of care that this just does not meet.